thrilled to have Dr. Bishara with us. Dr.
Thank you.
Bishara, thank you so much for being here with us today.
Thank you for having me.
Really looking forward to this session. As we let our viewers tune in, can you tell us here at Haute Beauty what your biggest takeaway has been so far from the pandemic?
Actually, it's interesting because what we've realized as clinicians and as humans, right, kind of all experiencing this together, is that our immune system plays a huge role in our overall health, right? And I think we took it for granted in the past. So my takeaway has definitely been, let's work on strengthening our immune system because our body really is our best defense.
Absolutely. Can you tell us a little bit about how your office specifically handled the pandemic?
Well, unfortunately, because my office is a wellness practice and it wasn't an emergency type clinic, it was closed. We were in New York City when the pandemic first started. And so my office was closed for a few months, the first 3 months, which, you know, a lot of people would say it's unfortunate, but it actually gave me a lot of time to do research, to look into more COVID-related conditions and what was causing some people to get sick versus others. So it gave me that time to not only spend with my kids, but also kind of do research that I never would have been able to do otherwise.
Thank you so much, Dr. Bishara. So I'm going to go ahead and formally introduce you. Dr. Bishara, in addition to being a tremendous partner of the Haute Beauty Network, is the founder of From Within Medical, a medical wellness practice that places emphasis on the mind, body, and gut-brain axis to prevent and manage disease. She is board certified in internal medicine by the National Board of Physicians and Surgeons and is certified in integrative medical weight loss by the American Academy of Anti-Aging Medicine. Welcome, Dr. Bishara.
Thank you so much.
And thank you again for being a tremendous partner of the Haute Beauty Network.
Absolutely, my pleasure.
So just kind of to start things out and to get going, you touched on it a little bit. What are some things that viewers can do at home to boost their immune system?
Well, that's a really good question because, what we're realizing is our immune system is sometimes called the guardian of the galaxy, right? And so the reason it's called that is because it kind of looks out for things that might cause injury or illness to our body, and it patrols, and if it finds something that's a little bit worrisome, it, so to speak, calls for backup. So it's very intricate. It involves many different types of cells, but the beauty of the immune system is it's always working to try to protect our body. And a lot of people don't realize this, but our immune system, the majority of it is actually in our the GI tract. So we should definitely start there talking about how can we improve our immune system by starting with the foods that we eat. And so I'm going to go into a little bit with that, talk about gut health, which is so vital for our overall immunity, but also talk about what can we eat to improve that. And so what I usually focus on in my practice is, because I don't believe in diets and I don't believe in restriction, I believe that everything in moderation, but I usually focus on trying to get my patients to increase their healthy eating. And there's a reason behind that. And I always like to explain the scientific evidence behind why that is. And so what we usually recommend is a 70-30, which is 70% plant-based, so fruits and vegetables, and then 30% other, which includes proteins. Again, I don't like to restrict. And the reason why the 70-30 ratio is so important is because 70% of that food that we're eating, fruits and vegetables, it contains antioxidants. And why are antioxidants so important? Well, if we look at how our body functions, things like, even COVID or infections or any kind of process that's going on in our body, it releases something called free radicals. And what free radicals do, I don't know if many of the viewers have heard of free radicals, but everyone has them. Some people have more free radicals than others, and I'll tell you why. But free radicals are basically the byproducts of any function that's going on in the body. When you're sick, your free radical levels are a little bit higher. And so free radicals are unstable molecules, and they're unstable because they don't have an even number of electrons. So they circulate in the body, causing damage. So how do we counteract that? How do we reduce the free radicals circulating in our body? Well, luckily enough, foods that contain high antioxidants actually donate an electron to a free radical, so it ends up stabilizing that free radical, and then it ends up not causing as much damage. So that's why it's great to have, like be armed basically with a high antioxidant level in our body, because the higher your antioxidants are, the more you're able to fight free radicals and less likely to cause cell damage. So definitely, fruits and vegetables are I always say start with food. So start with fruits and vegetables to increase your antioxidant levels. Another thing that we can do to naturally boost our immune system, but also naturally increase our antioxidant level, is to limit our alcohol intake. And I know this is like the elephant in the room, and a lot of people don't want to really hear that. But alcohol, unfortunately, does cause release of a lot of free radicals. And when that happens, you deplete your liver of a lot of the antioxidants that it makes naturally. So what happens is when your body is depleted of those antioxidants and it's not able to fight those free radicals as well as it should. And so that's why we really also, I recommend limiting alcohol intake to like not more than 2 to 3 times a month. I know that's a surprise for a lot of people, but really, and we've seen cases, I don't want to bring up COVID as like the one case where we've seen, but we've seen a lot of people who are getting sick from COVID and more sick that may have depletion of their antioxidants and their livers are affected. So it plays a role in our overall immunity. The other thing that we can definitely do to increase our immunity naturally is give our body that time of a break where you're not eating. So it's called restricted time eating or intermittent fasting. And it's very trendy nowadays, intermittent fasting, but it's been around for many years. Ancient societies practice intermittent fasting. A lot of societies, even like societies like the Blue Zones, they don't eat all day long. They eat small meals and they eat them in a condensed amount of time. So I would say definitely restrict your time of eating to no more than 8 hours in a day. Especially at nighttime, because you don't want your body, while you're asleep, your body is working on renewing your cells while you're sleeping. And if you're eating late at night, for example, what's happening is your body's now focusing on digesting food versus the other processes that it usually does during the night, which is cell renewal and recycling and just kind of getting everything back in order. So definitely another way to do that is with fasting.
Thank you, Dr. Bishara. Do you have anyone that struggles with that? The thought of not eating 4 hours before bedtime is a tough pill to swallow for me personally, and I'm sure other people feel the same way. How do you handle clients that maybe struggle with that?
Yeah, that's a good question, because it's definitely not something that some people are used to, especially if you work long hours and you come home and you eat a big dinner and then you're kind of just eating until you go to sleep, or you're watching television and, people want to snack and eat while they're playing on their phone or watching TV. But what I would say is definitely start with 12 hours, for example. So restrict your time of eating to 12 hours a day. And your body's amazing in that its number one priority is survival. So it's always trying to survive it the best way that it can. So try it 12 hours first, and then you can see how it goes, and you can shorten it to 10 hours and then 8. Another way you can actually do intermittent fasting is through alternate day fasting. So if you find that the time restricted is hard for you, then you can do something called alternate day, which you eat normally on one day, and then the next day you limit your calories to like 500-600 calories the next day, and then you kind of alternate. So some people find that that's a little bit easier. Some people find restricting the time of eating is a little bit easier. Both are very effective in improving your health and getting a lot of things generated in terms of cell recycle and cell renewal.
Thank you, Dr. Bishara. Do you have any specific supplements that you would recommend that people take to boost their immune systems?
Yeah, that's a really good question, actually. So, as we talked about antioxidants, number one way of getting antioxidants is obviously through our food, but we can also get antioxidants by taking certain vitamins. And there are a lot of supplements that we can take, but I'm going to try to focus on just a few because I know many people can't remember everything. So vitamin C is definitely a good one. And I think if anything came out of our pandemic is that so many people now are supplementing, right, with vitamin C and vitamin D, and those are really important. I would also add a probiotic to that regimen if you're taking vitamin C and vitamin D. We all know vitamin C is a great antioxidant. Vitamin D is great too because it does have some antioxidant properties, but it also helps to regulate our immune system directly. So it helps to regulate our immune cells, our T memory cells, our B cells. So it definitely plays a vital role in our gut immune system. And unfortunately, so many people are deficient in vitamin D. And I think the pandemic has probably made it worse because so many of us have been indoors and not getting that sunlight exposure. So I would definitely say to check your vitamin D levels if you haven't checked them with your doctor. But vitamin C and vitamin D are in my opinion, vital. The other big one is probiotics, and probiotics are known to increase our immune system because they regulate it. So you can either take a probiotic by pill, or you can take a prebiotic, which is food. Fruits and vegetables are prebiotics, and they help your gut bacteria actually develop and grow because you want more good gut bacteria than bad gut bacteria.
What should someone be wary of when looking at probiotics or trying to boost their immune system?
Good question, because I think a lot of people feel that if it's natural and it's a vitamin or a natural supplement, it's okay to kind of self-medicate. And to a certain degree, they're probably right, but it's definitely good to follow up with your doctor before you start anything. I mean, I think vitamin C and vitamin D in lower doses is not a problem, but I see so many people that are supplementing with other natural supplements that either they're getting too much of a dose or their body doesn't need it and it interacts with certain medications or medical conditions. So definitely worth following up with a doctor before you start supplementing.
Thank you, Dr. Bishara. You've touched on this a little bit, but can you really explain to us the importance of gut health?
Yeah, I'm a big proponent of gut health. And the reason being is that, you know, a lot of people don't know this, but our gut microbiome has trillions of microorganisms in it. And those microorganisms regulate a lot of our immune system. They regulate a lot of pathways. And you want your gut health to be, you know, like I said, I mean, more good gut bacteria than bad gut bacteria. And so you want to feed it the right things to develop the good. But, you know, there's also, you know, this other realm of gut health that really a lot of people don't talk about, but it's gut brain health. And it's vital that we realize that, you know, a lot of what we're eating does affect our mental health and our mental well-being. I'll give you an example. Like, for example, a lot of people know the neurotransmitters dopamine and serotonin. Dopamine helps us focus. It helps to give us energy. Well, the precursor of dopamine is tyrosine and phenylalanine, which we get in certain foods. Certain foods are very high in those, like fatty fish, nuts, fruits and vegetables, things like that. So if we're not eating enough of those, then we're not going to be able to make dopamine. Same thing with serotonin. A lot of people don't even realize that serotonin, the majority of the serotonin receptors are actually in our gut. And serotonin stabilizes our mood. So if we're not getting the proper food to feed our gut and to make those nutrients, then we're not going to have those precursors for our neurotransmitters. And that's where we're going to have that mental health imbalance and that even that cognitive function imbalance that a lot of us feel sometimes. So definitely big gut brain axis is huge. And I'm a big proponent of gut health.
I know that you've done a lot of research regarding gut health and its relation to COVID-19. Can you talk to us about that?
Sure. Well, actually, that was kind of a side effect of the pandemic of me not working for a few months. And so let me explain. My husband is actually a pulmonologist and critical care specialist. And we live in New York, so we got hit with the pandemic pretty early in March. And so he was kind of thrust into the front lines early on. And so he covered the ICU from the beginning. And, you know, a lot of us didn't really know anything about COVID. I mean, even a lot of doctors really had not had too much experience with COVID infections. So he and I would have nightly conversations about the patients that he was seeing, what kind of treatments they were giving. And so it was very interesting what he had to tell me. And every night, almost every night, he would tell me the same thing. He says there's a certain subset of people that are getting really sick, and it's not necessarily the elderly. It's not necessarily the those with comorbid conditions. I mean, there were those, but then there was this whole other subset of people who had a very high level of inflammatory markers, and they were giving medications that inhibited these inflammatory markers. One of them is something called interleukin 6. Now, interleukin 6 is part of our immune pathway. It's actually protective. So what happens is, like we talked about with the immune system, it's kind of like the guardian. It looks for things that, are bad for us, and it kind of like sets this immune response. Well, one of those immune responders is actually interleukin 6. The problem with interleukin 6, sometimes if it's too much of a good thing, it's not good for your body. And so what they were finding in the ICU was that there were already a lot of patients that were getting sick that had higher than normal levels of interleukin 6 to begin with. So these people were starting off already with higher levels. And the way you can perceive it is your body is always in survival mode. If it sees that it's getting any kind of, like we said, any kind of injury or insult, it's going to release its inflammatory responders, right? And interleukin 6 is one of them. So I found it very interesting that these inhibitor medications were working on that. So it kind of got me starting to see which patient demographic is actually having higher levels of this interleukin 6. And it turns out that people with high BMIs have higher than normal levels, people who are diabetic, people with heart disease, elderly patients, basically the same people that, were high risk. And I started thinking, well, what is it about children that's protecting them, right? Because children, for the most part, aren't really getting very sick. Well, it turns out that children's guts have a much higher concentration of one specific strain of gut bacteria called Bifidobacterium. And many people have heard of Bifidobacterium because it's usually one of those probiotics that people say, like, make sure it has Bifidobacterium in there, because the studies in the past have shown that that's been a really good gut bacteria in terms of immune health. So we looked at and we researched things that showed that children had much higher levels. And actually children's guts, the majority of children's guts are Bifidobacterium, like 60 to 80% of their gut. And oddly enough, that number starts to decrease as we get older, and it's very low in the elderly. I mean, some elderly patients have less than 10% of their gut with that specific strain, and people with high risk conditions also have lower levels. So I started to kind of see if maybe these two things kind of fit together. Well, it turns out that not only does Bifidobacteria work on regulating the immune system, it actually worked on the same exact pathways that COVID is affecting. So my husband and I were talking about this. I said, this is really interesting. So I wanted to make sure it was matching up clinically, but I wanted to make sure that this was also something that was matching up molecularly as well. So I wanted to check with the pathways and see if they were lining up. Does Bifido really affect these specific immune pathways? So, and I'm sorry if I'm going into it a little bit deeper, but.
No, this is great.
Yeah, so I spoke to a couple of scientist colleagues, a geneticist and a molecular biologist, and we kind of worked together on this research. And indeed, the pathways did match up. And so that's when we knew that there was definitely something to it. And we believe that this is what's protecting children from getting severe infections, is that this higher level of that strain of bacteria, which works directly on regulating the immune system, is what's protecting them.
Thank you, Dr. Bishara. Shifting back over to intermittent fasting.
Yep.
Can you, because we're getting a lot of audience questions on it, can you reiterate how it works specifically to strengthen your immune system?
Absolutely. So we could go into a little bit more detail on that. So number one, if you're not eating all day long, what happens is you're not releasing insulin all day long, right? Because when we eat, we need to get that glucose into our cells, right? So insulin helps with that transport. I think we all know that, right? But what happens is, think of too much insulin as the boy who cried wolf. And insulin resistance, because what happens is if you're eating all day long, you're causing that spike of insulin release, right? And so if your insulin is being released all day long after many meals, your cells kind of become immune to that. They don't respond to it as well. And then what ends up happening is the glucose remains in your bloodstream. So when we're eating in a longer period of time, we're developing the tendency or the likelihood of developing insulin resistance because of the fact that we're causing those insulin surges more frequently than we should be. So that's one thing. Intermittent fasting definitely helps to prevent insulin resistance because you're eating during a restricted time period, so you're not having those constant insulin spikes. The other thing is, like I mentioned, is when we're not eating, our body still needs to provide fuel to our cells. So if it's not getting it from glucose from food, well, it needs to find another way. And so the way that it finds it is it has two mechanisms where it does that. It goes to the fat, and then it starts burning fat and using that for fuel. And a lot of people know that because a lot of people do keto type diets, right? But another way that it provides fuel to our cells is through stored glycogen, which is in our liver, and it turns into glucose for our cells. And believe it or not, those are much more efficient ways of providing fuel to our cells, especially our brain. So you'll hear a lot of people that do intermittent fasting will say, you know, I wake up and my mind is very clear because of the fact that they're being fueled, their brain cells are being fueled by, you know, it's basically like having regular unleaded versus, you know, premium. And so that's really another way that intermittent fasting works, is because after a certain time, our body needs to go to that second plan. If it's not getting glucose from food, it needs to go into, you know, burning fat and, you know, utilizing glycogen. And so that's another reason why it helps to boost our immune system, because our immune system's not going to be working on digesting food. It's going to be working on other processes in the meantime. The other thing that it does is cell renewal. So as I mentioned, when we're sleeping, this is the time where our cells recycle and renew and just regenerate. And so when you're limiting your time of eating, it's allowing your body to focus on those processes during the night. And that's usually when it happens. So
many benefits to it.
it is, yeah.
Audience question, is there an age limit? Is there an age where it could potentially be dangerous to do intermittent?
Well, yeah, and that's a good question. If you're a diabetic, or you're someone who is prone to diabetes, or someone who's on blood pressure medications, for example, or, you know, very, you know, elderly or comorbid conditions, you definitely check with your doctor. And I would not recommend starting on, you know, restricted time eating until you've kind of worked up to it. So I would say if you're new at it, you know, start with a 12-hour fast, for example, and see how your body responds, and then do that for a week. But if you're diabetic and you're on medication such as insulin, definitely talk to your doctor about it, because, you know, you don't want to have any drops in your glucose levels.
But other than that, there's no age limit.
No, and I would say for the majority of people, healthy individuals, intermittent fasting is a great thing to incorporate, you know, daily if they're going to do restricted or alternate day. There's also another type of fasting that's 5-2, and that one is eating for 5 days normally. And then you do 2 days where you're restricting your food quantity and time. So you eat one meal that's about 400 or 500 calories, and you do that for 2 days. So you do 5 days on a regular diet and then 2 days of intermittent fasting. So
what are your thoughts of eating properly 5 days a week and then 2 days a week maybe you eat not so properly?
Yeah, you know, I mean, we're all different, right? And so that's not something that I can sustain. For me, what works really well for me is doing 8-hour restricted time eating. So usually I finish eating, you know, at 5 o'clock in the evening, or 6 o'clock. And then I don't usually eat until, you know, late morning the next day. And that's something that I've been doing for many years. So for me, it's something I'm used to, but we're all different. So I would say try it out and see which works better for you. Some people do really well on the 5-2. And actually studies have shown that the 5-2 plan is actually the best for those who are pre-diabetic. So again, something to try. Definitely talk to your doctor and make sure that that's something that you're okay doing.
Going back over to the audience, how long would you say it takes you how long do you think it takes to get used to the intermittent fasting lifestyle?
You know, as with anything, I would say give it at least like 3 to 4 weeks. And I think if you kind of know the mechanism of why you get hungry, You know, a lot of people feel hungry in the evening, right? And then they eat, and that's kind of what restricts them. But if you find out, like if you know the reason why you get hungry, then you're more likely to actually stick to it. So what happens is, you know, we talked about insulin and we talked about eating, but what happens is when you don't eat, your insulin levels drop, right? So you're not eating, your insulin drops. Well, like we said before, our body's always ready for survival. That's its number one goal, survival. So what happens is when the insulin drops, you get hungry. That's actually a side effect of a drop in insulin. It stimulates your brain to tell you that you're hungry. And so you go and eat, right? Because your body needs fuel. And so what happens is you go and eat, and then your insulin goes up. But, and this is something that I think a lot of people will find interesting because they probably experienced it. If you ignore that hunger, say you go to bed hungry, right? Or you ignore that hunger, because it's usually like that 1 or 2 hour window, right? In the evening before you sleep, you get hungry. In the morning, you never wake up famished, do you? Like, do people wake up? I mean, I don't. People don't usually wake up very hungry. You do?
Mm-hmm.
Well, then you need to try it a little bit longer and then kind of work your way. But usually what happens is the reason why you're not as hungry is because then your body kind of kicks into plan B, which is using glycogen and the fat as fuel. So I say give it 3-4 weeks, you know, and start with a little bit longer time period and kind of work your way down. It's good for weight loss too.
This is another audience question on this topic. How would you recommend someone get rid of the mental fog or fatigue in fasting?
Well, actually, the mental fog and fatigue occur because our body is so used to glucose as fuel. But if we start fueling our cells with alternate means, right, which is burning fat, ketosis is it's a much cleaner fuel for our cells, and glycogen being burned, then you're not going to have that fatigue anymore. And another reason for that fatigue and that mental fog is because, again, when we're eating all day long, your body's not focusing on other resources that it needs to focus on, other functions in the body. It's focusing on digesting, right? So you're not getting as much fuel to your brain, for example. But when your body is restricted, then it knows what it needs to do.
So it's really just getting used to it and letting your body shift over to a new fat burning source.
Exactly. It's like any habit, you know, any habit you kind of have to work on for a little while before it becomes part of, you know, who you are. So.
Thank you, Dr. Bishara.
Sure.
More audience questions on the subject. Is it good or bad to exercise while in intermittent fasting?
It's not a bad thing. It's actually, if you can handle it, the best time to exercise is when your fast is like, you know, 14 or 16 hours. So right before you're breaking a fast is actually the best time to exercise, because you're really utilizing that alternate fuel for, you know, burning fat.
So first thing in the morning, right?
Mm-hmm. Yep.
Thank you.
Yeah.
Dr. Bishara. What about bloating? Could it be coming from someone's diet? Are there foods they need to stay away from? This is from someone that's 90% vegan.
Okay. Yeah, I mean, you know, and this is another reason why I usually will, if you're having symptoms like bloating or gas or, you know, a lot of GI symptoms, I usually recommend a gut analysis because of that reason. Because sometimes if we have what they call is like dysbiosis, which is basically you know, a ratio of bad gut bacteria versus good gut bacteria. Sometimes you have a little bit of inflammation in your gut, it can cause that bloating, or if you have a food allergy. And so a lot of times it's just, you know, like these mild inflammatory changes in your gut that are showing up as symptoms. And so instead of treating those symptoms, we really need to get to the root to find out why are we having those symptoms? What's going on with our gut? So those are what I would start with, you know, a gut analysis and just kind of do a thorough history to find out what kind of foods you're allergic to, things like that.
And you handle all of that testing in your office, correct?
I do, yeah. I also do antioxidant testing because, you know, it is important, and I think a lot of people don't know. They're eating healthy, they're doing everything right. So it's good to see, it's good to monitor and say, you know what, let's check your antioxidant levels to see if they're high or not. And then we can work on ways to increase them.
Going back over to supplements from the audience,
Yeah.
is there anything that you recommend outside of probiotics and
And
prebiotics to maintain gut health?
I'm sorry, I didn't understand the question. So other than probiotics or specific probiotics?
Other than that are other supplements that someone could take?
Yeah, I mean, again, I do a very thorough evaluation in my practice where we go through, not only do we do like a nutritional history, but we also do like a neurobiological history where my patients complete a questionnaire so that I can see if their neurotransmitters are deficient, like are they deficient in serotonin, are they deficient in dopamine? Is this why they're feeling the way they are? And then based on that, we recommend certain supplements. So everyone's assessment is different. But I believe that when we stabilize our gut health and our neurotransmitters, then it's when we start to feel well. And actually, a lot of times, then we kind of lose those cravings. So it's hard to say which supplements I would recommend without kind of doing that assessment. But what I would say is this definitely, if you're going to take anything basically home from this talk, is make sure you're taking vitamin C, make sure you're taking vitamin D, make sure you get a vitamin D level checked, because I would say maybe like more than 2/3 of my patients are deficient in vitamin D. If you're darker skin tone or African American, definitely get your levels checked, because the darker your skin tone is, the less likely your body's able to absorb vitamin D, because it requires melanin. And if you have too much melanin, then it makes it difficult to absorb it. So I would say vitamin C, vitamin D, and a probiotic containing Bifidobacterium is a really good place to start, those three.
Thank you, Dr. Bishara.
Mm-hmm.
What about foods? Is there a superfood that someone should try to incorporate into their daily diet?
Yeah, I mean, there's so many, but I would say if you're doing plant-based, definitely a lot of vegetables, a lot of fruits, not as much like of the sugary fruits, but like berries are great. They're very high in antioxidants. Beans are really good too. And again, you have to see what what you like. Fatty fish is great. So like salmon is really good. And the reason why salmon is so good and fatty fish in general is because things like vitamin D, for example, vitamin D is a fat soluble vitamin. So when you have something like fatty fish or like avocados, your body actually absorbs the vitamin a lot better if you eat those foods, because they get absorbed, like the vitamin D gets absorbed in fat soluble foods a lot better than it does in not. So definitely another reason why we should incorporate good fats, like avocados, fatty fish. I know some people are vegan. Definitely incorporate, beans and nuts for that fat.
Going over to salmon,
Yeah.
I've heard, is there like a specific salmon you should be going for that if you eat, it's like the wrong quality of salmon that actually will inflame you?
I'm so glad you asked that. Stay away from anything that's labeled farmed. And sometimes it's not labeled at all as farmed. Food companies have gotten really good at hiding the fact that it's a farmed fish, because they know that it's not as healthy. Usually you want to look for something that says wild caught, and you want to see where it's caught. Anything that says like ocean wise or farmed, or, just be wary. Like it should say wild caught, because wild caught salmon definitely has a lot more of the nutrients that your body needs versus farmed fish. No farmed fish at all, I would say, definitely. So things like tilapia, like a lot of people say, I'm having tilapia. Well, actually tilapia is strictly a farmed fish. So there is no tilapia in the wild. So if you're having tilapia, it's 100% likely that it's farmed. So definitely look for wild caught.
Thank you,
Mm-hmm.
Dr. Bishara. Going back over to your practice as a whole, can you talk to us about your approach to beauty and health and how they go hand in hand?
Absolutely. I mean, my practice is called From Within Medical. And the reason why I picked that name is because I'm a true believer in our bodies being able to naturally heal from within. And so I feel like beauty always complements feeling good, right? Like when you feel good, you want to look your best. And so that external beauty always reflects our internal health. And I think we've all experienced it when we're eating healthy, we're drinking enough fluids, and we're glowing, right? And so that's what I really try to focus on, is kind of healing from within. but sometimes we need a little bit of boost too. And I do like to utilize things that help us naturally boost our body's, beauty, so to speak. So we usually incorporate things that will naturally help increase your collagen production. So for example, I'll do microneedling and radiofrequency, and that stimulates your body to promote collagen production and increase that naturally. Another thing that I love to do is, for example, people will come in for like IV immune boosts. A lot of patients have been coming in for a glutathione and a vitamin C IV. And glutathione is similar to vitamin C, is that it's an antioxidant, and it's actually made in the liver. It's the most powerful antioxidant that our body makes. And if we're deficient in it, it's definitely going to, cause some issues. So the only problem is with glutathione, we're not sure how much of it gets absorbed orally. I mean, I take a glutathione supplement daily, but when we give a glutathione IV and vitamin C, because those are both really strong antioxidants, they have a side effect, a beneficial side effect of causing your skin to glow and help you look your best. So I try to incorporate, a little bit of the natural, healing from within and looking great from within with a little bit of the boost. So.
Going back over to the nutritional aspect, we have an audience question.
Yep.
For someone that does not eat fish, they're not going to eat fatty fish, can they take a fish oil supplement with vitamin D and receive the same benefits?
Absolutely. Yes. And if you're not eating fish, if you're vegetarian, then I would say focus on foods that are high in fat, monounsaturated fats, foods like avocados, foods like nuts. Those are great. And definitely I would recommend fish oil is one of the big ones that I usually recommend. Yes. Try to have at least 500 milligrams of that.
Thank you, Dr. Bishara. So we know here via Haute Living and Haute Beauty, you have some very exciting news, something you came out with. You're the creator of the virtual peel. Can you tell us about this?
Yeah, well, it's funny because a lot of things came out of this pandemic, and I guess it's a silver lining. There's always good that comes out of something that's bad. And so, in our office, we do medical grade skin peels. And because my office, as well as a lot of offices, were closed during the pandemic, we weren't able to do that. But, I had so many patients contact me that wanted to do these peels and just wanted to look their best. And so what we started doing is doing a pre-screening where you can get the peel in the mail. It's the same peel that we use in the office. And then you schedule a virtual consultation. So I do a pre-screening where we make sure you don't have any contraindications. We take a look at your skin. And then what happens is then we schedule a virtual consultation, and I do a step-by-step walkthrough. So for example, if you wanted to do it, then you have everything laid out and we're talking just like we are right now. And then I guide you step-by-step safely on how to apply it. And so you're kind of getting the same benefits as you would with an in-office peel, but instead you're doing it from the comfort of your own home. And it's been really great. So that's been really something that also kind of came out of this pandemic. Necessity is a mother of invention, right?
Yes.
So.
A quick question on that. How do you guide someone between a laser, a peel, RF frequency therapy?
Mm-hmm.
What's the determining factor?
Yeah, those are good questions. So usually like a laser, what that'll mostly help with is if you have a lot of like hyperpigmentation. So if you have a lot of dark patches, lasers are really good for that. Microneedling and radiofrequency are very good for like less loose skin, or if you want skin, like rejuvenation or tightening. What that does, it's really good for that because it stimulates, again, it stimulates collagen by creating these very small injuries in your skin. And then with the combination of radio frequency, so we're causing these microneedles to go in at a depth of like up to 4 millimeters. And then what's happening with that is that the radio frequency has heat, which stimulates your collagen even more, and then it kind of tightens. So it's more for like tightening skin, getting rid of acne or acne scars. If you have any like, neck jowls or just things are starting to get a little bit loose, microneedling radiofrequency is great for that. In terms of the peel, I recommend the peel to anyone really who kind of wants to do that like skin maintenance like a couple of times a year. So what happens with that is you put the peel on and it's really getting rid of all that excess, pigment that you acquired, especially like now is a great time to do it because a lot of people in the summer get, tan, and then it just kind of peels off that top layer and rejuvenates and helps again, kind of renew your skin and increase collagen production. So the peel is more for like kind of rejuvenating your skin and getting rid of pigment. The microneedling and radio frequency is more for tightening and kind of getting rid of that lax and loose skin. And laser is good for both, but it's really more for like hyperpigmentation.
Thank you, Dr. Bishara. Looking ahead, can you just sort of give us a quick synopsis of what we've discussed, everything that should be on someone's bullet point list for really boosting their immune system?
Absolutely. So like we talked about, we definitely always want to start with food. So you want to start with food that's plant-based because that's providing prebiotics, which your gut bacteria, develop with. The prebiotics is the fruits and vegetables, but it also helps to increase your antioxidant levels as well. So fruits and vegetables, try to make those, at least, I know it's hard in the beginning, but at least 50%, and then work your way up to 70%. So foods rich in antioxidants, I would say vitamin C, definitely, vitamin D. And those dosages are going to vary based on your needs. So definitely a good idea to check with your doctor and have your levels checked, your vitamin D levels. And, if you're interested in checking your antioxidant levels, I'm happy to do that in my office. But it's always good to start with like 500 milligrams of vitamin C, 1,000 milligrams of vitamin D, and then see what you need. The other thing is, again, incorporate a probiotic containing Bifidobacterium, especially now with everything going on with COVID. They're working on a vaccine, but most likely aren't going to get a vaccine for at least another year. And so the study that we found that showed that Bifidobacterium really does regulate the immune system, specifically the one that COVID works on, is a really promising study. And it's definitely something that you incorporate into your diet, having the probiotic as well.
Thank you so much, Dr. Bishara. Going back over to the skincare, the peels, the laser, or frequency, could a peel assist someone in preventing skin cancer?
Assist?
A peel.
Can a peel, I'm sorry, what was the rest of the question?
The question, it's from an audience member.
Okay.
Could that be a preventative measure in preventing skin cancer?
No, a peel is really more for just kind of, basically think of it as like, a snake that sheds its skin and has like new skin. It's basically like that. It just kind of rejuvenates. It's definitely not, a skin cancer prevention type thing. It definitely, always have your skin checked if you're prone to it or any risk factors. So it's not, no.
Thank you, Dr. Bishara. Can you go through the best way to get in touch with you?
Sure. You can either go to my website, fromwithinmedical.com, or you can email. All that information is on my website. Or if people are on social media, I'm on Instagram and Facebook. And my Instagram and Facebook names are at Dr. DOCTOR Christine B, CHRISTINE B.
And then what about your office hours?
So my office hours vary. Right now, we're seeing patients in the office a couple of times a week, but we conduct a lot of virtual exams and a lot of things we've been able to do virtually. So those are, flexible, and definitely, email and see if we can accommodate.
Thank you, Dr. Bishara. Another audience question back to nutrition.
Sure.
What are the foods someone should avoid at all costs?
Let's see. Well, definitely farmed fish. That's one. Really, if you can, try to eat as much organic as you can, because it really does make a difference. There's also something called the Dirty Dozen. I don't know if you've ever heard of that, and the Clean 15. So the Dirty Dozen are the types of fruits and vegetables that they have a high level of pesticides in them, and it's always good. Every year a new list comes out, so definitely avoid the dirty dozen, the fruits and vegetables on that list. The other thing that should be avoided, and unfortunately this isn't on food labels, but there's another chemical called glyphosate, which is present in a lot of cereals and a lot of products. Definitely worth avoiding that as well. So those are the things I would definitely say no to.
What about soda? So this particular person got soda.
Good point. Yeah. Soda, whether it's diet or regular soda, is bad. And the reason why is sugar. I mean, we know that the sugar is pro-inflammatory, but diet sodas, the ingredients in diet sodas are actually endocrine disruptors, and they actually also mess with your gut bacteria. And so they kill off your good bacteria, and then you end up having like a not good proportion of good versus bad. The only one that doesn't do that, the only sweetener that has shown not to do that is stevia. So if things are sweetened with stevia, then it's okay, but obviously you don't have that as, you know, your drink of the day 5 times a day. But all other artificial sweeteners are endocrine disruptors. So definitely avoid sodas.
What about, I mean, agave is a good sweetener that's natural, correct?
Yeah, agave is natural, but it's got a high glycemic index. So I would say don't sweeten everything with agave either. You know, a little bit goes a long way. So I would say if you're going to do honey, like Manuka honey is great. It has a lot of anti-inflammatory components in it. So
is monk fruit included in that as well? Is that another
yes.
one?
Yeah, that's like stevia. You can that one's safe.
Thank you so much, Dr. Bishara.
Mm-hmm.
Looking ahead to the remainder of 2020, what do you think the biggest takeaway is that someone should take from this?
You know, I mean, just from what we've seen this year is the difference in the discrepancy in who's getting sick and who isn't is let's just invest in our immune health. Would be my one word of advice is just kind of invest in your own health. And your body is capable of healing itself. Your body is capable of defending itself, and it's always in survival mode. So let's feed it what it needs to do that properly.
Thank you so much, Dr. Bishara. Thank you for your partnership and for all of your time that you've spent with us today.
Absolutely, my pleasure. Thank you.
Looking forward to so much more with you ahead, and wishing you and the whole team a great remainder of the week.
Thank you, you as well.
And looking forward to seeing you soon.
Thank you, you too.
Thank you.